Hola, molt bona tarda i benvinguts a aquesta sessió sobre les oportunitats del sector salut als Estats Units. Per començar, fem un breu repàs al programa, que s'estructura en dues parts. Obrirem amb la intervenció de l'Oficina Exterior d'Acció Nova York, a càrrec d'en Robert Negre i la Judit Cendra, que ens oferiran una primera visió del mercat i presentaran el Servei d'Expansió Internacional per Tecnologies Mèdiques. Aquest servei s'ofereix pels mercats del Regne Unit i França i aquest any l'ampliem també a Dinamarca i als Estats Units. És per això que hem convidat a l'Antonio Martínez, de l'empresa Time is Brain, que compartirà la seva experiència com a usuari del servei. La segona part de la sessió anirà a càrrec d'en Frank Jaskalki, de medtech, que ens presentarà les idees clau per accedir amb èxit als Estats Units. Al final de la sessió disposarem d'uns 10 minutets per un torn de preguntes que podeu anar fent durant la sessió. Si en teniu alguna directament per en Frank, us demanem, sisplau, que la feu en anglès. Si no, nosaltres mateixos li traduirem i finalitzarem a les 5 de la tarda. La sessió s'està gravant i tant el vídeo com les presentacions estaran disponibles a la nostra pàgina web a partir de dijous. I bé, donat que parlem d'Estats Units, permeteu-me que faci un últim apunt. Us recordo que podeu utilitzar el servei gratuït de l'Oficina Tècnica de Barreres a la Internacionalització per resoldre qualsevol qüestió relacionada amb arancels o regulacions i que podeu seguir l'actualitat aranzelària a través dels webinars setmanals que fem. Finalment, us animo a contactar amb mi mateixa. Soc Sílvia Vila, consultora d'internacionalització sectorial d'acció de l'equip a Barcelona, per si necessiteu que us connecti amb qualsevol de les 40 oficines que tenim a l'exterior. I ara sí, comencem la presentació amb en Robert Negre, director de la nostra oficina exterior a Nova York. Endavant, Robert.
Moltes gràcies, Sílvia. Bona tarda a tothom. Moltes gràcies per participar en aquest webinar. Soc en Robert Negre, director de l'Oficina d'Acció Nova York, des d'on, com sabeu, donem suport a les empreses catalanes en el seu procés d'entrada al mercat dels Estats Units. Per donar-vos una visió general dels projectes amb els que donem aquest suport a les empreses catalanes, doncs comentar que treballem de forma molt habitual amb empreses que, primer de tot, el que volen és conèixer els requisits per poder entrar en aquest mercat i això ho aconseguim doncs, fent una aproximació de mercat per conèixer els principals players, on estan ubicats els potencials clients, normativa, aranzels, canals de comercialització. I un cop tenim aquesta informació, el que fem és, d'acord amb l'empresa catalana, doncs, decidir quins són els players que volem contactar per organitzar aquesta entrada al mercat, no? I a partir d'aquí doncs anem a contactar amb clients, distribuïdors, agències de representació, el que haguem decidit per originar l'inici d'aquestes negociacions per entrar al mercat amb ells. A part d'aquest tipus de projectes, l'Oficina de Nova York està especialitzada en projectes d'anàlisi d'ubicació per obertura de planta productiva als Estats Units per les empreses que estan preparades per fer aquest pas en aquest mercat. Comentar també que des dels Estats Units us podem ajudar i donar suport en el procés d'obertura d'una filial comercialitzadora. Aquest, moltes vegades és un pas, un requisit que s'ha de fer per poder entrar al mercat i fins i tot a vegades tenir personal al país. Treballem amb empreses de tots els sectors. Tenim, tot i això, certa especialització perquè tenim diferents oficines als Estats Units. Tenim oficina a Nova York, a Washington, D.C., a Miami i a Silicon Valley. I bé, des de l'oficina de Nova York, un dels sectors d'especialització és el de ciències de la salut. Ens sentim bastant còmodes treballant en aquest sector i treballem regularment amb empreses que comercialitzen productes medtech, dietary supplements o medical devices. Pel sector de la salut, Estats Units és el principal mercat del món. Hi ha moltes oportunitats que ens agradaria ajudar-vos a explorar a través del programa que us presentem avui. Tenim el suport de consultors externs. És un servei que ens ha funcionat molt bé en els mercats de UK i de França. I bé, compteu amb nosaltres per tot amb el que creieu que us podem ajudar. Passo la paraula ara a la Judit Sendra. Ella és doctora en biologia i consultora de l'Oficina de Nova York i a continuació us presentarà el programa que hem dissenyat. Endavant, Judit.
Moltes gràcies, Robert i Sílvia, per la introducció que heu fet. Per mi és un plaer estar aquí presentant finalment aquest servei d'expansió internacional als Estats Units. Com ja han comentat la Sílvia i el Robert, ja es fa des de fa uns anys a Londres i França i ha sigut un èxit i teníem molta il·lusió de començar ja als Estats Units perquè, com ha comentat el Robert i veurem a la següent slide, és el primer mercat sanitari del món. Als Estats Units el mercat sanitari representa als Estats Units un 18% del PIB nacional. I no només això, no és el tamany de mercat que té. Com veieu a la taula de la dreta, podem veure que el tamany de mercat és molt gran, però veiem que hi ha en els propers 5 anys un creixement que suposen oportunitats per totes les empreses del sector salut, incloses les nostres, de Catalunya. Veiem que el sector farma, que és el mercat més gran del món, té un creixement estable d'un 5-6% que sempre es manté pel tema de l'envelliment de la població, les cronicitats i pel tema dels biològics també. El sector biotech veiem que és un mercat també molt gran als Estats Units i a sobre s'espera un creixement en els propers anys d'un 10-12%. Això és principalment pel tema de les teràpies gèniques, cel·lulars i per la recerca i desenvolupament tan gran que es fa als Estats Units. I després tenim el medtech, que també hi ha sempre una demanda constant d'aquests productes pel tema de l'envelliment de la població també. I trobem un creixement de mercat aproximadament del 5% en els propers 5 anys i el digital health, que com sabeu és el més dinàmic. Hi ha moltes innovacions en aquest sector, s'espera fins a un 15% de creixement en els propers 5 anys i aquí hi ha un gran impuls en part pel tema de la intel·ligència artificial. Com veieu, amb el tamany de mercat i amb el creixement que s'espera, tenim moltes oportunitats en aquest mercat. Nosaltres, jo ja fa 5 anys que treballo amb les empreses del sector salut d'acció i hem après quines són les coses que fan falta per entrar a aquest mercat. I el que hem après és que als Estats Units té moltes oportunitats, però és un mercat molt complex. Té una complexitat no només a nivell regulatori, sinó també per mercat, hi ha molta competició, i pel coneixement del sistema sanitari. Tot això fa que incrementi el temps que es necessita per entrar al mercat i els costos. I què hem vist durant aquests anys? Que normalment les empreses catalanes coneixem molt bé el tema de la regulació i un cop tenim la regulació més o menys controlada ja volem entrar al mercat americà. Però hem vist que no, que aquí fa falta un coneixement molt més ampli del sistema sanitari, de com funciona, ja que és molt diferent del sistema sanitari que coneixem a Catalunya. Tenim un sistema privatitzat, tenim diferents players, hem de conèixer millor qui paga qui compra, qui decideix i a qui hem de convèncer que el nostre producte és competitiu, que és millor que altres i què li hem de dir, què els interessa sentir en aquests compradors. Perquè tenim el tema de les asseguradores, el reimbursement és molt diferent al de Catalunya, aleshores és molt important que abans d'entrar al mercat americà coneixem molt bé qui tenim, qui són els players i amb qui hem de parlar. D'aquesta manera aconseguirem que les empreses, un cop entrin en aquest mercat, estiguin preparades i tindran més probabilitats d'èxit de tenir una entrada més eficient i més ràpida. És per això que hem creat aquest programa amb el que podrem definir una estratègia individual d'internacionalització per cada empresa segons el seu producte. A qui va dirigit aquest programa? Parlem de sector salut en general, perquè aquí tindrem experts locals i aleshores podrem parlar de tots els productes que estem treballant a Catalunya, des de medtech, salut digital, biotech, diagnòstic, inclús farma, si teniu algun interès. Nosaltres analitzarem totes les sol·licituds i estem oberts a tot tipus de producte. Què volem? Que el producte ja estigui acabat, que hi hagi ja facturació mínima de l'empresa i que hi hagi experiència prèvia internacional. És a dir, ja estem comercialitzant aquest producte. Fem algunes excepcions amb productes molt innovadors que encara no estan al mercat, però veiem que hi ha una necessitat molt clara i és una innovació molt clara que pot haver interès en el mercat americà a adquirir aquest producte abans d'estar comercialitzat. Nosaltres analitzarem totes les sol·licituds, conjuntament l'Oficina d'Acció amb una consultora externa amb la que col·laborem, i es podran seleccionar un màxim de 10 empreses per any. I com s'estructura aquest servei? El servei consta de 3 sessions d'1 hora amb un expert consultor extern local que es faran, són personalitzades per cada empresa. Nosaltres hem fet aquesta estructuració, són en total 4 hores perquè fem 3 sessions d'uns temes concrets i deixem una quarta hora per preguntes i respostes. L'estructura inicial l'hem fet així perquè creiem que és el que encaixa més amb totes les empreses, però repeteixo, serà personalitzat per cada empresa segons les seves necessitats. Una primera sessió seria per conèixer el funcionament del mercat, el que comentava abans, dels players que tenim, amb qui hem de parlar, qui compra, qui fa servir, qui decideix i com es fa el reimbursement, una mica un coneixement global del sistema sanitari als Estats Units. Després validem que la tecnologia té un encaix als Estats Units, com s'ha de presentar, a qui li hem de presentar i quin enfoc s'ha de fer. I finalment es prepara una ruta al mercat. Com hem d'entrar a aquest mercat, a través de quins canals i quins són els passos d'entrada. I finalment deixem una quarta sessió on es faran preguntes i respostes o possiblement és una altra sessió amb un contingut específic que l'empresa necessiti, per exemple, regulació. I repeteixo, això no és fixe, això és flexible segons les necessitats de l'empresa, que nosaltres les podrem detectar amb la vostra sol·licitud, farem un diagnòstic, però també es pot parlar directament amb l'empresa si són aquestes les vostres necessitats per estar segurs que les sessions que farem amb l'expert són adequades segons les vostres necessitats. Qui és el nostre expert? El nostre expert, hem fet una recerca de diferents consultores i hem trobat aquesta medtech que ens ha demostrat que tenen un ampli coneixement del sector en diferents àrees, tant medtech com healthtech i biotech o diagnòstic. No només això, sinó que ells tenen els contactes per donar servei a totes les empreses i a totes les necessitats que tingui l'empresa. Concretament serà el Frank Jaskulki, que ell té molta experiència treballant amb medtech i concretament amb empreses de fora dels Estats Units que volen comercialitzar als Estats Units. Aleshores, ell ens aporta coneixement del sector, experiència amb empreses estrangeres que volen entrar al mercat i també molts contactes, perquè aquesta consultora l'hem conegut a través de contactes que tenim a la Mayo Clinic a Minnesota i la veritat és que té molts contactes que ens poden ser molt útils per totes les empreses. Les sessions estarà el consultor i també estaré jo com a experta del sector als Estats Units, que també m'asseguraré que totes les preguntes estiguin respostes, que hi hagi tota la informació necessària i faré el seguiment de totes les sessions. Què ve després d'aquest programa? Com deia el Robert, nosaltres tenim diferents serveis. Aquests serveis alguns de vosaltres ja el coneixereu perquè són els serveis que oferim des de les oficines exteriors a totes les empreses catalanes. I aquí, segons la ruta d'entrada que haguem definit amb el nostre expert, nosaltres podem oferir-vos els nostres serveis segons les vostres necessitats, que ja sigui la búsqueda de clients finals o distribuïdors. Pot ser que el que es necessiti és la implantació d'una filial comercial o d'una planta productiva, com deia el Robert. O igual hem detectat que la millor manera d'entrada sigui a través de partners, de farmes, de departaments d'innovació d'hospitals. Aleshores, aquí també podem fer projectes personalitzats segons les vostres necessitats. Aquest seria el següent pas després del programa d'internacionalització d'aquest servei que estem presentant i en el moment en què sigui oportú per l'empresa. Tenim la sort de tenir avui amb nosaltres a l'Antonio Martínez de Time is Brain. Ell va ser la nostra prova pilot del servei perquè ell va entrar al programa de Startup Launchpad que fem als Estats Units per les startups que volen conèixer millor el mercat i està més enfocat a presentar startups que estan en fases més inicials. Però treballant amb ells vam veure que la seva necessitat estava més enfocada al mercat, com entrar, no? I estaven més avançats i vam dir, bueno, és una empresa que és perfecta pel programa d'expansió i ja teníem el consultor i tot estructurat, anem a fer una prova pilot. I jo crec que és molt important que vosaltres sentiu l'Antonio, que ens doni el seu feedback sobre el programa, què destacaries i què és el que us ha suposat a vosaltres a l'hora d'entrar al mercat.
Hola, Judit, molt bona tarda a tots. Jo sóc l'Antonio Martínez i sóc el responsable de vendes i desenvolupament de negoci a Time is Brain. Som una startup del sector medtech que va néixer l'any 2020, fundada per 3 neuròlegs a l'Hospital Germans Trias i Pujol. I nosaltres hem desenvolupat un dispositiu medtech portàtil que es diu Brain 20 i que permet el monitoratge del cervell en temps real en el cas d'un ictus isquèmic. Això és disruptiu, no existeix res comparable en aquest moment. Per nosaltres, en el plan de vendes, el rollout market, els Estats Units representen un mercat prioritari tant per la seva magnitud com per l'efecte atractor que exerceix sobre altres mercats. Això i la nostra voluntat d'aprofundir una miqueta en el coneixement del mercat ens va portar a apuntar-nos al programa US Startup Launchpad d'acció. I bueno, aquest programa ens ha ajudat molt a definir l'estratègia d'entrada als Estats Units, que ara ens la plantegem d'una manera molt diferent al que pensàvem inicialment, ja que durant el programa ens van aportar informació nova, molt valuosa, que o bé desconeixien o simplement no havien valorat prou bé. Això ens permet tenir més clar com funciona el mercat americà i com s'hi hauria d'entrar. Algunes coses, per exemple, que ens va portar aquest programa són, que no havíem valorat correctament, són la importància i la necessitat, per exemple, d'establir una seu social als Estats Units abans d'emprendre activitats en aquell país, el funcionament de l'estratègia del reimbursement, que és el motor de tot, i també com lligar-la amb la FDA, el funcionament del sistema sanitari, que com bé ha dit la Judit, és força diferent de l'europeu, està molt basat en el model hospital a hospital i consta de diferents actors en el procés de presa de decisió i decisió de compra. L'enfocament de l'estratègia comercial el vam haver de repensar perquè nosaltres a la resta de països, per exemple, volem treballar amb distribuïdors locals, però aquests tipus de distribuïdors no existeixen com a tals als Estats Units. O sigui, hem hagut de repensar la nostra estratègia. També és important tenir consciència de la lentitud del cicle de venda i de que el procés de venda i fins que tinguem un retorn és realment llarg i requereix molta inversió i una planificació molt acurada dels recursos abans de fer el plan de desembarcament. Sí, també se'ns obre la possibilitat de subcontractar a determinats serveis, com per exemple assessors pel market access o per algunes altres activitats de cara a no tenir tants costos fixos d'entrada, no, en el país. La veritat és que vam quedar molt satisfets del programa, ens ha estat molt útil de cara a replantejar-nos i a redefinir la nostra estratègia d'entrada al mercat americà. O sigui que només tenim que paraules d'agraïment per tots els que en van prendre part, tant en aquest cas tu, Judit i el Frank, que sou presents avui també. La veritat, vam quedar molt satisfets.
Moltes gràcies, Antonio. Jo crec que és molt important que les altres empreses que participen en aquest webinar sàpiguen què aporta aquest programa, no? I com pot ser de decisiu a l'hora d'entrar al mercat americà. Moltes gràcies, Antonio.
A vosaltres.
So now I'm going to change to English allow me to change to English because I'm going to introduce to Frank Jaskulki. Of course, the sessions with Frank will be in English this year at least. Give him time to to learn some Catalan. No, so thank you so much. He is our partner in crime for this program. He has been very involved preparing the sessions. So let me introduce very briefly because he's going to make us a very interesting presentation. I already introduced a little bit about you and Avion medtech, Frank, but let me say that he works with smart people who save lives. His career has been focused on improving healthcare system to save lives always. After 20 years at the Medical Allied Association, a trade group for healthcare leadership, he joined Avion medtech Consulting in fall 2024 to drive the growth of the company. And now he works with startups and scale-ups around the globe to bring life-improving innovations to the market. Frank is going to present some slides about the 10 most common mistakes that companies make when they try to go to the US market. And very important, he's going to talk about how to avoid them, right? Frank, thank you so much for being here today. The floor is yours.
Thank you. I really appreciate the warm welcome and the opportunity to chat with many of you today. Let me just get this loaded up so you can see it. As we're going through, as had been mentioned, throw questions in the chat. I'll be monitoring those and we'll try and incorporate them as we go through. And afterwards, if you have other questions, my email is right there. Judith will have my contact. Always glad to help out. As was mentioned, what I'm going to talk about are the most common mistakes that I've seen companies make in the healthcare space when they seek to enter the US market. This comes from having worked with startups around the world for the last 20 years, and there were patterns to the challenges or the roadblocks that they would run into over and over again. So we spent time researching those and then trying to address both what is the problem and then how do you avoid it or overcome it. A big caveat to this, you're all professionals, you're doing a lot of work, you know what you're doing. These are observations. I'm not the device entrepreneur, I'm not in your seat, but I've seen these things happen over and over again, and I've realized that practice matters. The first and the single most common one that I see is failure to validate the market in the US. The US healthcare market is very different in scale, in scope, in the way it's paid for in so many areas compared to other markets around the world, including the market in Spain. And so just because you have a product that addresses a clinical or economic need in Spain or somewhere else doesn't necessarily mean it will address the same problem in the same way in the United States. You need to understand what the US market is and how your product fits. And if you don't do this, all the other things that you might do will be for naught. So the most important thing here is to make sure that you're talking to all of the stakeholders that are involved. If you have a surgical device, it's not just the surgeon who has to make a decision. There are administrators, there are nurses, there are payers, there's supply chain and procurement. And when getting this sort of stakeholder input, third-party validation helps. You can reach out, you can get input, and you should do that. But it's also helpful to get someone who isn't tied to your product and your company, because we're all at least a bit biased about our own work, and we can't get the most honest answers out of people because we're going to subtly influence with the questions we ask. The other part of it is to really understand the difference in workflows, that the way care is delivered, the way a patient arrives, is worked up, presents for treatment, varies from country to country, and in the US, even sometimes from state to state. And so your product may address a clinical need, but not fit into the workflow, and that can create a challenge that can stop all the other forward progress you might make. Second area that I see companies mess up on quite often is that people and mission focus. They often have a great team working on their own product, but they don't recognize that to commercialize the product, may need a different team or a different composition of team. Investors will often say that they would rather invest in an A team, a great team, with a B or a middling technology versus a middling team with a great technology. Where companies struggle, though, is that the team needs change. People who are great at product development are not necessarily great at commercialization. People who are great at commercializing in one country may not know how to do it in another country. So early on, recognize that you may need to change your team composition. You may even need to change yourself in the role that you play in your own company as you're bringing the product to market. Third area, you all know this, healthcare is a highly regulated industry everywhere, but I see quite often that companies do not fully appreciate what their regulatory strategy involves. They get very, very focused on what's the fastest, lowest cost way to get market authorization, whether it's a 510K or a 505B for a generic drug, and they're not thinking about what is necessary to drive adoption, right? So if you're a medical device and you get a 510K, you can legally sell the device. It does not mean anyone will buy the device. You may need to have clinical evidence. You may need to have reimbursement in place. That regulatory strategy is one component of it, but it should be integrated early on, preferably before product development, with your clinical and evidence strategy, with your reimbursement and payer strategy, and with your sales and marketing strategy. And you may discover that a more time-consuming, more expensive regulatory approach could actually be lower total cost and faster time to sales, because it means, for example, you have more evidence to drive adoption. Don't let regulatory be the driver of the ship when ultimately you don't want market authorization, you want sales adoption. The next one in a related area is insufficient evidence. This is a highly technical, scientific industry, and yet I regularly talk with entrepreneurs who have built a company and they're like, trust me, it works. And they don't have clinical evidence. They don't have papers published. They have maybe a few case examples that they did, but they don't have robust evidence that says it creates clinical value or economic value in the environments that they want to bring it to market. So that can even mean you have clinical data in Spain, in, say, a Spanish healthcare environment, but you haven't done that sort of work in a US environment, where it might be paid for differently, the patient might be worked up differently, and the flow through healthcare could be very different. You want to make sure that you have sufficient evidence to drive adoption, which goes all the way back to that market validation work that you should have done, to get inputs and find out, hey, what do your customers need to be true in order for them to purchase and adopt your product? Increasingly, we see a lot of products that are connected. They have IT systems, they have algorithms, maybe they have AI. Data security and compliance is one of those regulatory burdens that has been growing and growing. Most hospital systems, if you have a connected product, are going to require you to demonstrate at least SOC 2 and high trust compliance. And you won't just do that once. You will probably have to do that for every healthcare and hospital system you go to as a customer. If you don't invest in building good systems, good compliance technologies, good reporting, you're going to spend a lot of time in security audits over and over again. And that cost you saved early on may come back to bite you in all that extra time and effort you spend trying to make every sale. The next one that I see a lot is cost of change, or rather discounting the cost of change. If you're bringing a new product to market, you're asking people, doctors, nurses, administrators, to change something they might have done for a very long time. They might have practiced medicine in a certain way. They might have done a procedure in a certain way. If you are not showing them that changing to your product is worth the effort, right? The clinical value is sufficient, the economic value is sufficient, then even if you're better, you may not get adopted. And I will tell you, it always takes longer and costs more to make change than you predict. No matter what you think it is, it will take longer, it will cost more. The solution, I've really only ever found two. The first is to be a very small and niche change. It's easy to adopt and the benefit is clear, even if it's not big. So I don't have to do a lot of work in order to adopt this change. The second is to be truly transformative, right? To give them a clinical and economic impact that is so big that it is worth putting in the work to make the change. What you don't want to be is in between. It's a bit better, but it takes a lot of work to change. That'll never get adopted. There are plenty of other problems that your customers are dealing with every day. You are in a battle to get them to pay attention to the problem you want them to. You need to make it worth their while, worth their time to change. If you don't, it doesn't matter if you have evidence, it doesn't matter if you have money, you won't be able to get adoption, you won't get sales. Excuse me. On that point, another one we see, especially companies that haven't done work in the US before, is they underestimate the cost of sales. R&D can be expensive, product development can be expensive, sales and marketing is far more expensive. And in the US, even more so. Partly, wages are higher, our costs are higher in general. A really good sales rep might make $500,000, $750,000, even $1 million. They'll often make more money than the CEO of the company. Why? Because they're selling so much product. They're worth every penny, right? If you're using a distributor model, they've got to get paid. They might need 30, 40% of the sales price to cover their costs. Then you got marketing, right? You got to drive demand. You got to go to the trade shows. You're building inventory and you're carrying that inventory. You have your cash tied up in inventory, and then the hospitals might take 6 months to pay you. You need the cash just to stay alive from the time you make the sale to when you actually get paid for it. And if you're not sufficiently capitalized to build out that sales team or distributor network, to get the inventory out there, to ride through the procurement process, you might make a few sales and then run out of money and not be able to build momentum. And this is where many device companies in particular, but also in biotech, in digital health, and in diagnostics, you see the idea of the limited market release. Very few companies actually launch in the US. Why? 350 million people, physically very large. I can fly from Minneapolis, where I'm based, to London in less time than I can fly from New York to Los Angeles, right? That has a real cost to your company just getting around the country. So instead, what you can do is a very targeted launch. You might pick one hospital with one salesperson. That salesperson might even be you for a while, where what you're doing is you're getting in the door and you're proving that you can make a sale. You're learning mistakes, right? You're going in, you're finding out what worked and what didn't work. You're keeping your costs down. You're not making a lot of revenue, but when you make mistakes, you're going to make them small. They're not going to be costly. You're going to learn from them. And then when you hire the second rep, they'll make fewer mistakes because you learned on that first rep. And when you hire the third and the fourth and the fifth, you'll have worked out a lot of the problems and now have what's called a repeatable sales model. And that's what a lot of the investors are going to be looking for, that you've demonstrated a repeatable, scalable sales model. What you don't want to do is hire 30 reps, blanket the country, and then find out that you had something wrong. You priced it wrong. Your approach was wrong. And now you made a mistake at scale, a big costly mistake that you probably can't recover from. So you want to constrain the sales costs, right? You fail small, your mistakes are small. You target a very specific area so you can concentrate effort, your marketing, your sales, your supply chain, all in one place, and then reinvest the gains. You generate a bit of revenue, you hire a second rep. You make new mistakes, you learn from them, you generate a bit of revenue, you hire a third rep, and then a fourth, and so on until you scale. All of that, of course, requires capital. If you're a startup, you might be trying to fundraise. If you're an operating company, you might have your own internal resources and you want to deploy them effectively. If you're a small business, I'm of the mindset that we're all broke, right? There's never enough capital. There's never enough time. And in healthcare and in medical device, in biotech, in digital health, it is so expensive, right? So if you are going to raise capital, and if you are going to raise capital in the US, first, make sure that you truly understand how much you need and for what purpose. It is far worse to raise too little money and then a few months later have to go out and raise again than it is to raise too much money and now have the capital that you can invest for a longer period of time. And if you're doing that, it is very important that you understand what kind of capital you're going to raise. There's sometimes a perception that in the US, there's so much venture capital backing so many startups. And while this is partially true, it belies that behind that, there are so many companies that don't get funded. And a lot of them, what they run into is that they approach venture capital, but they don't understand what venture capital is as a business. Venture capital is a type of financing that needs a very specific type of business. You need to be able to grow very rapidly. We're talking 100% or more a year in many cases, in very large multi-billion-dollar markets with a pathway to sell the company in 5 to 7 years, likely to one of the big strategics, a Medtronic or a J&J, a Roche or whoever, or to go public to do an IPO. If your business doesn't fit that profile, or if you don't want to pursue venture capital, that is A-okay. But you should understand where you do fit so that you can align your financing strategy to your business needs, not the other way around. I see a lot of companies that they're knocking on the doors of the VCs, getting told no over and over again. And it's not because it's a bad business, but because it's not a venture backable business. And in doing that, it is really important to know yourself and to know the stakeholders, right? If you are going to raise capital from venture capitalists, understand how their business works, right? They are a business. They have a job to deploy capital and generate returns far greater than what you might get in the public markets. So understand what their motivations are so that you can tune your message to them. Second, the number one thing that a venture capitalist looks for is not the market, it is not the technology, it is not the science, it is the team. If they don't believe that your team can generate a financial return, they will not deploy the capital. This is the number one thing that you need to work on. And then finally, make sure that the materials don't have errors, that are well put together, especially if you're translating things, right? It pays to have an English-speaking friend to go over the materials and make sure that all the things are captured right. Those little things the VCs will be looking for. Why? Because they need to say no to 300, 400, 500 companies in order to find the handful that they actually want to invest in. The other one that comes up a lot, although thankfully I'm seeing more and more companies understand this is an issue and address it early on, is neglecting reimbursement. 10 years ago, companies just kind of blew through this. They pretended it didn't exist. Now the challenge that I see regularly is companies know they need to confront reimbursement, they need to figure it out, but they haven't taken the time to understand how healthcare is paid for in the US. And so they make assumptions about the things they can do in order to get reimbursement that aren't right. And I will tell you, like, all of these things matter, but the reimbursement part really matters if you've done all the other work, right? Like, reimbursement is not the first thing you should worry about. It's what you should be looking at after you've validated market, after you've addressed all the other challenges. Then you want to know, can it actually get paid for? And in doing that, a couple of things to know. First, payers truly do care about clinical improvement. It's actually not all about the money. For-profit healthcare in the US, there are a lot of things people misunderstand about it, but one of them is that it's only economically driven. First and foremost, they start with clinical improvement. The problem that companies run into with payers is payers want more proof than the hospitals and the doctors want. They want you to show them evidence that your product actually delivers the impact you claim. For a lot of products that are going after, say, like a 510K if it's a medical device, a generic drug, or say a digital health improvement that doesn't have clinical evidence, this is a really hard thing for payers to get behind. They want evidence. The other thing to note is scale. United Health Group, which is based here in Minnesota, is larger than the entire U.S. medical device industry, both in revenue and employment. Why does that matter? Because if you're building a product, if it doesn't address a $50 or $100 billion market, it's hard to get a payer's attention. They're probably not going to take a meeting with you. They're not going to give you advice. They're not going to tell you how to get reimbursement, right? It's not that what you're doing is unimportant. It's that it's not a big enough deal for them to pay attention to. They have other challenges they have to deal with. So whatever you're doing, you need to build health economics, clinical value, and show outcomes. If you do those things, there are pathways to get new reimbursement, to get the codes, and to get the coverage, but you should be planning for it early on so that you can make sure that you don't end up on market able to sell your device, but no one will buy it because there is no payment for it. And with that, I'll stop and open up for questions. Final thing I'll say to you is, we get it. Startups are hard. Scale-ups are hard. Entering a new market is hard. What you're doing is challenging, and I appreciate that you do it because you're bringing products that'll help make patient care better.
Thank you so much. Thank you so much, Frank. It is a really interesting and helpful presentation for everyone here. We don't have questions so far, but I'm not sure if we are having some problems with the chat and the Q&A, but we can discuss while we are trying to figure out. One of the things you said, it was about the scalable sales model. This is I think it's a different model from what we are used so far in our market, because we are very used to work with distributors. And here is very important, the role of the sales reps. And it's something that when I talk to the Catalan companies, they say, no, I prefer to work with distributors. So can you clarify a little bit this?
Yeah, great thing. A big difference between the US market and I'd say Europe broadly in healthcare is direct sales versus distributors. There are distributors in the US, and for certain technologies, they make sense, but it is very different. Fewer products work with distributors in the US than in other countries. So even companies that we work with in the US, they might have a direct sales force here, and they're working with a distributor in a European country. Why is that? One, you have a lot larger markets that can support a direct sales force. Two, it's just kind of historical. It's the way a lot of the companies have developed. So if you're bringing a company to the US, one of those first analyses should be, is your product appropriate for distributor or does it need direct? There's a handful of criteria, but one of the most fundamental that I use is how much change does your product introduce? If your product is very similar to an existing one on the market, it doesn't require a lot of new training to use, it's kind of a better version of something that already exists, there's probably distributors that can bring that out. If, on the other hand, you have a product where it's a new surgical technique, it's going to require training or new systems, then you probably need a direct sales force. Distributors are not very good if it's a product that requires a lot of what we would call market development to bring forward.
Yeah, this is very interesting. So our attendees today need to understand that deciding between sales reps or distributors, it's not it's something that we can't decide. It's the market who says, no, this product needs to be done by these reps. It's much more effective. And also one question, what they prefer the distributors because they expect them to have all these role to negotiate pricing, to stock the product, to ship the product, to talk with the hospitals. It's like this. It's much easier to work with the distributors.
Yeah, and there's half of that in the US that's very common. There are many organizations that can handle the stocking, the logistics, return orders, compliance that are great for startups and small companies, so you don't have to build that infrastructure. It's kind of the last mile, if you will, the hospital relationship and procurement, where it's more challenging to find distributors in the US than it is in Spain or across Europe.
And who talks with the payers, or how to decide the price of the product?
Oh yeah, all right. So on payers, like you're going to hire a consultant, like full stop. You are going to. It is technically possible that you as a company could figure it out. It's highly unlikely. Like you could go to Medtronic and J&J, and they don't know how it works. They have hundreds of people that they employ just to figure that stuff out, right? So you're going to get help. On the pricing part of it, it's a really hard thing. If you're making a product that is similar to something already on the market, odds are good your price is going to be about the same, maybe a little more, maybe a little less, because that price is probably driven by the way the reimbursement works, and you're unlikely to change that amount. If you're bringing a truly new and novel product that has big clinical benefit, there are processes you can apply for to demonstrate to the payers that you should get paid more for that product, right? That can allow you to then to have premium pricing, to have higher pricing, but recognize it is a lot of work. It takes a lot of time. It is totally worthwhile if your product is good enough, but you should, again, get a reimbursement consultant early on to help you figure that out. A good one, you'll spend a few $1,000s to get information that could impact millions of dollars of revenue. Yeah.
You have these contacts for us.
Yes. Yep. Yeah.
We have the Q&A working finally.
Yeah.
I'm glad it wasn't working. I'm sorry. So let's gonna go to the questions there.
Yeah.
They are in
I
English,
just go
so
through
they are for you.
starting at the top. Yeah. So Dennis had asked about innovations coming from the US market into the European ecosystem. So I've worked on that as well. And about the same set of challenges. The US companies, when they go to different European countries, they kind of make the same mistakes, right? If they don't get help early on, they make assumptions about the market that are based on what they know in the US, and they run into problems. So you can flip it around about the same.
Then John Mark.
Let's see. Do U.S. life science pharma diagnostic companies, oops, another question to come in, I lost, give me a second, like to undertake co-development? All right, so this is a great question. In pharma and biotech, that is very common. If you're developing a new drug, the large bio and pharma companies have big teams who go out and find little companies to partner with and co-develop. If you're doing diagnostics, there's some of it. It's not as common, but it does happen. If you're doing device or digital health, it's uncommon. It does happen, but it's very rare. In medical device, by and large, the large companies are not interested in co-development unless it is a highly specific area that they have an interest in. So it happens, but not often. In device. In pharma and biotech, very common.
Mm-hmm. Then Maxim is asking something very interesting. Is there any better state or region to launch a medical device in the US?
So it really depends on your product. And this, I will say, this is something that comes up a lot when I talk with companies from Europe. So the US, right, is one country. We have 50 states. Each state, there's kind of roughly a corresponding European country where it might be similar size. But healthcare is regulated federally by and large. And so the rules are roughly the same. And there are not state programs, right? So healthcare in the US is fundamentally paid for by me or the federal government, right? There's not a lot of state money that gets involved. So where you should pick to put your business should be dependent on where your business needs to be. Where do you find a good customer? Where's the supply chain? And what I would tell you, your sales reps, they're going to be remote. They aren't going to be in an office. So put a sales rep in Florida, put a sales rep in Houston, wherever. Your office, should you need one, put it in a place where you can find people who work in your industry. If you're building a biotech company, you might go to Boston. It's expensive, but all the capabilities are there. If you are building a device company, you might come to Minnesota because we have the largest medical device cluster in the country, right? But your sales reps, they're going to be all over the place.
Yeah, this is interesting, and let you know that we can help you to decide the best location for your company here in the USA. This is one of the things we do from our office. Then there is another question that's interesting because Luis Manuel says that this point about distributors, will it be the same for private sector, for example, private clinics in fertility? Any advice?
Yeah, it'd be the same. And like in the US, there's not really a difference between public and private. There are no public hospitals or health systems. In fact, in the US, if you said like a state hospital, like that'll sometimes come up, that would have a really specific meaning, usually referring to a psychiatric hospital. So you should assume all healthcare in the US is private. In fertility clinics in particular, that is true.
Okay, and I'm reading now the question from Mikel Casas. Maybe you can read to it will be better. Hello, we manufacture an orthopedic device for foot and ankle, manufactured in Barcelona. We already have the 510K clearance, and we are just entering the market with a distributor strategy. All of them are asking to consign the stock with them, not paying the stock until they do the same. This is a huge investment.
Yep, and that is very common, especially for new companies. The risk is on you, right? You have a 510K. You're in orthopedic, foot and ankle, very competitive market. I have one of our board members used to be the CFO for Tournier, which does a lot of extremities orthopedics, including foot and ankle, right? Super competitive market. If I'm a distributor and some company I've never heard of shows up, yeah, you're paying me, right? That's a lot of risk for me to take on. And if you don't want to pay, there's other companies I can go after. And that's part of you need a lot of capital in order to just support the investment to enter the US market.
Yeah, it's hard.
Yeah.
So there's
Yep.
a question. Yeah, there's a question from Eric Verdaguer. He says from Logmill, it's moving. For an FDA-approved solution in hospital kitchens that generates decision-grade food intake monitoring data, food recognition, portion quantification up to, wow, it's moving. I don't know if you are reading, Frank.
Yep. Yeah, I can. So ask me, what's the best commercialization path? So I don't know that I can this quickly say, hey, this is the best commercialization path. But what I can say is in a product like that, you're going to first want to validate with your potential customers, like, do they care? Will they buy? And if they will, you can go and look out into the market to see, are there distributors that might carry something like this? I don't think there are distributors that sell these kinds of products. Maybe the medical nutrition companies, you think of like a Nestle or a Novartis Nutrition, but I suspect you would need a direct sales force to start. Direct is the most common approach for medical device in the US outside of orthopedic. Orthopedic is the one area where you still see mostly distributors.
Thank you. There is a question from Arturo Casanovas from ClipFab. We have with them. They have a disposable product for anesthesia, a respirator accessory, and then for the reimbursement, there is this part of the coding that not everybody knows. And this is a part of a bundle, and maybe they don't have a specific code. This is something that you can very briefly explain.
This is great. So a lot of healthcare in the US is paid for with bundles, often called DRGs, diagnosis-related groups, where let's say I had heart failure. I go into the hospital. The hospital is going to get one payment that is going to cover all the care they provide to me for that. It's called episode of care for the heart failure. So let's say it's $100,000. That $100,000 is what they're going to use to pay the physicians, the operating room time, the medical devices, the supplies, the food. That pays for everything. So if you introduce a new product that is used in a bundle that's part of that care, you're introducing new cost and there's a fixed amount of revenue. So you've now lowered the hospital's profit. They will do that if you can show you provide clinical and often economic benefit, but you will need to prove it. Hey, you don't need to use this other device and you save money. It reduces the time they're in the hospital, and now you're not paying for as much hospital time, right? So you can bring that product in, they will adopt it, but you need to show the economics. So a common thing is actually to do a profit and loss statement, a P&L of that care. You would show hey, here's the revenue coming in, here's all the stuff you're going to spend, our product fits in there, and then because we're going to reduce these other costs, you now do economically the same or better, even though you bought our product.
That's very interesting, and we will learn how to do this, how to demonstrate the clinical improvement and low costs. So let's finish with this question that is very clear from Stanislao Lopez. He says, does it make sense for a medical device development company in Europe to compete with the US?
It does. Yeah, this is a very open market. Notwithstanding all the challenges you've seen that have been going on, it is still a very welcoming market for new innovation if You bring things that make it clinically better, economically better, and hopefully both. If you do that, lots of companies have come over and been successful. And on the flip side, there are plenty of US companies that make the same mistakes, that have the same problems, and they should know better, right?
Thank you, very clear. So we expect you to come to this market. There are a lot of opportunities. Thank you so much, Frank, for your time, for being so clear, speaking about our mistakes and how to avoid them. Thank you to all the attendees and for your questions. If you have any questions, you have our contact. You can contact us directly or to Silvia Vila in Barcelona. Ask any questions, and of course, if you want to register to the program, you will find the information through Silvia, through us, or directly in the website. Thank you so much to everybody for being here today.
Molt bé, moltíssimes gràcies i també agrair de manera especial l'Antonio Martínez, en Frank, moltes gràcies a tots dos i per suposat la nostra oficina exterior a Nova York i com deia la Judit, si teniu més preguntes, us ha quedat algun dubte, feu-nos arribar per correu electrònic i us contactarem ben aviat. Moltes gràcies.